In today's video, I will be talking about soft palate. So let's begin. Soft palate is a movable muscular fold suspended from the posterior border of the hard palate. This area over here, the whole structure is the soft palate. It separates the nasopharynx from the oropharynx. Soft palate has two surfaces, anterior surface, posterior surface, and it also has two borders, superior border and inferior border. The anterior surface is a concave surface. As you can see here, it is cave-like and it is marked by a median raphe. The posterior surface is convex in shape and it continues superiorly with the floor of the nasal cavity. The superior border over here is attached to the posterior border of hard palate and inferior border is free. Now I will be talking about muscles of soft palate. There are 5 major muscles of soft palate. The first one is tensor velli palatine or tensor palati. Second one is levator palati or levator villi palati. Third one is musculus uvulae. Then we have palatoglossus muscle. And lastly, we have palatopharyngeus muscle. Tensor velli palati. This is the first muscle that I will be talking about. Its origin is at the lateral side of the auditory tube. This is the auditory tube in blue. And also its adjoining bone, which is mostly greater wing and scaphoid fossa or sphenoid bone. It inserts at the posterior border of the hard palate and inferior surface of palate behind the palatine crest. Its action are to tighten the soft palate and it opens the auditory tube to equalize the air pressure between the middle ear and nasopharynx. This normally happens when all of a sudden your ear pops out when there is a change in air pressure or change in altitude. This happens because of the action of tensor villi palatine. Next muscle that I am talking about is levator villi palatine. Its origin is next to the tensor villi palatine, which is inferior aspect of the auditory tube and adjoining part of the inferior surface of petrous part of temporal bone, and it inserts in palatine aponeurosis. Its action is elevating the soft palate and closes the pharyngeal isthmus, and it also opens the auditory tube like the tensor villi palatine. Next I will be talking about is musculus uvulae, which is this muscle over here. It originates from posterior nasal spine and palatine aponeurosis, as you can see over here, and it inserts in the mucous membrane of the uvula. Its action is to pull up the uvula. Next I will be talking about is palatoglossus muscle. Starts from the palate, goes to the tongue. So its origin is palatine aponeurosis and it inserts its insertion. So it makes the palatoglossus arch to the side of the tongue at the junction of its oral and pharyngeal part. Its function is to pull up the root of the tongue and approximates the palatoglossal arches, and thus it closes the oropharyngeal isthmus. Now I will be talking about palatopharyngeus muscle. Similar to palatoglossal, this is also starts from palate, goes to pharynx. It has two fasciculi, anterior and posterior. So the anterior fasciculus originates from posterior border of the hard palate and posterior fasciculus from palatine aponeurosis. It inserts in the posterior border of the lamina of the thyroid cartilage and wall of pharynx. Its action is to pull up the wall of the pharynx and shorten it during swallowing. So, nerve supply is a major question that is always asked in exams and MCQs. So, all the muscles of the soft palate except dash are supplied by pharyngeal plexus. So, here the answer will be tensor veli palati. The fibers of this plexus are derived from cranial nerve number 10 and 11, which is vagus and spinal accessory. And tensor veli palatine is supplied by mandibular nerve. So you must always remember pharyngeal plexus and mandibular nerve. All the general sensory nerves are derived from middle and posterior lesser palatine nerves, which are branches of maxillary nerve and glossopharyngeal nerve. The special sensory or gustatory nerves carrying the taste sensation are from lesser palatine nerve, and secretomotor nerves are also from lesser palatine nerves. Blood supply. To remember the blood supply, I have created a mnemonic which is GAP, G-A-P. So we have greater palatine artery, which is over here. Then we have ascending palatine branch of facial artery. This is the facial artery over here. So we have ascending palatine artery. And then we have ascending pharyngeal artery, which also has a palatine branch. Okay, let's repeat. Greater palatine artery, ascending palatine artery, and palatine branch of ascending pharyngeal artery. All the venous supply is from pterygoid and tonsillar plexuses of veins. And lymphatics, they drain into deep cervical nodes and retropharyngeal nodes. So for the function of palate, it plays a major role in mastication. So it isolates the mouth from oropharynx during chewing so that the breathing is unaffected. It also separates the oropharynx from the nasopharynx by locking the passavant ridge during the second stage of swallowing so that the food does not enter the nose. By varying the degree of closure of pharynx, the quality of voice can be modified and various consonants are correctly pronounced. During sneezing, the blast of air is appropriately divided and directed through nasal and oral cavity so that it does not damage the narrow nose. Similarly, during coughing, it also directs the air and sputum into the mouth and not into the nose. As for the clinical aspects, cleft palate is one of the congenital defects that is caused by non-fusion of the right and left palatal processes. It has many different degrees. The least severe type is class 1, which consists of soft palate only. And then as you can see here, as the severity increases in class 2, it has hard and soft palate involved. In class 3, we have unilateral, soft, hard, lip, and alveolar ridge involved. And in class 4, we have complete bilateral, soft and hard palate, and lip and alveolar ridge. Paralysis of soft palate in lesions of vagus nerve produces nasal regurgitation of liquids, nasal twang in voice, flattening of the palatal arch, and deviation of uvula to normal side. So if we are given this picture in clinical question and asked which side of the vagus nerve is affected over here, so the affected side is going to be the left side as the uvula is towards the right side. Thank you so much for watching the video. Please like, comment and subscribe to the channel.